Hi, welcome to the Christopher and Dana Reeve Foundation's Live Better series. I'm Julie Lubinsky. I am web manager here at the Reeve Foundation. Today's show is Dr. Dan on your changing worldview. Dr. Dan is really looking forward to a conversation, and to achieve that, we need to go over some technical details, and I'll turn it over to the Ready Talk operator for that.
Ladies and gentlemen, please note that you may unmute your line by pressing 6-6 if you wish to speak, and it'll be 6-3 to mute your line.
Thank you. Dan, are you with us?
Yes, I am with us after some technical difficulties on everybody's part. It's nice to be with everyone. It's nice to be with you for the first time, Julie.
I know. I'm very excited to be here. It's definitely wonderful. I love hearing your radio show as well as your reading all your comments on our community and participating in these webcasts. So I want to thank everybody for coming.
Yeah, me too. Me too. So here's my thought in setting this up, Julie, that everybody asks me, are you the same as you were before the accident? Would you have been different? Those kinds of questions. And I even got a question yesterday from a friend of mine who said, I'm involved now in this wonderful relationship. And she said to me, do you think you could have been in this kind of relationship years ago? And they're understandable questions. They're challenging questions. And, I think it's worth exploring. How has this accident changed us, no matter which side of the wheelchair we are? How has this changed us? Any trauma changes us, but all different. We're all changed differently. So I'd like to explore this about how we're different people than we were before all this happened, and the good news and bad news, because all news carries good news and bad news. It's like every medicine has a little poison. So that's the kind of thing I'd like to explore. And I do want you to chime in. You can also post something in the chat down here at the bottom. So you can post anything you're interested in the chat on the bottom. And I'll read it and respond to it.
I heard someone speaking. If you want to repeat your question.
Sorry, ma'am. Were you talking to me?
Yeah, I thought I heard somebody speaking. I want to make sure that you all see the chat window.
Yes.
Who is this?
This is Brian Bomboy calling. I live in Pennsylvania.
Okay.
And it was about 9.5 years ago I fell from a roof cleaning rain gutters. And I broke my neck in two and my back in three. They told me I would never use anything more than my eyes. I was pronounced dead 6 times. I was once in a coma. And since then, with therapy and 2 years of stem cell injections, I regained total mobility of my upper body. I can sit up on a 45-degree angle, and I can control both my arms. When doing range and motion, I'm able to push my legs back now. I've made amazing leaps that no one thought would ever be possible. And when I saw this was going on with the Christopher Reeve Foundation, I wanted to know how I could get involved in the clinical trial study, how to go about it, and just how to get in.
Right. So we have all that information on our website. frequently asked questions, and that would be at ChristopherReeve.org/EPI, and you can get all that information there.
Can you hold that 1 minute? Jenny, take this. Hold, just, ma'am, my nurse is here. I want you to repeat that to her.
Sure, I'll put it in the chat box as well, and so you can go ahead and look at that, and then we do definitely need to stay on topic with this subject of the webcast, but it's ChristopherReeve.org/EPI.
EPI?
Yeah, EPI, and you want to look for frequently asked questions, and it'll answer you there.
Okay.
Dan, you were saying about how you were even asked yesterday about, or recently a woman had asked you, how has your disability changed the way you view things? Now, is that something that, to be able to answer that, you first have to embrace that question and not, like, get really annoyed at the person asking?
Exactly.
Well, I'm able to do both. I'm able to both be annoyed and embrace the question. No, I really wasn't annoyed. I do appreciate the challenge, but yeah, you have to look. I think wisdom is being able to see things in context, Julie. To always look at the bigger picture. Now, it's hard to take a step back when you're in pain at the moment. If you cut your finger badly, you're not going to be able to look at the big picture about how your body functions and look at all the good things in your life at the same time. You want to get your finger fixed. So when we're in pain, physical, emotional, psychological pain, really that's all we can focus on. But when the pain is not acute, when it is part of our lives and what we live with, we can take a step back and look at the bigger picture. So wisdom is context. Wisdom is seeing context. So I always like to ask the big picture. So who am I? What does it mean to be in my skin, to live the life I have? Why am I here? What's my purpose? What do I want to accomplish with the life that I have? And how am I going to cope with the pain in my life? How am I going to live with it with grace? And these are the bigger questions I think we have to ask ourselves. And in today's society, we don't ask the bigger questions anymore. And I think it's so terribly important. So, yeah, the big questions. And this, what I'm bringing up here, is a big question. How have you changed as a result of this trauma? I've got a dear friend and colleague, Robert Nassif, who's got a son who is profoundly autistic, nonverbal, non-functioning, has had to be in a residential facility for years now. And Rob said, that he always thought that, his goal in life was to try to help his son become better. And little did he realize that it was his son that was helping him become a better person. And that's what I hear very often from people who have experienced a child with some disability, or someone who's experienced cancer, or a spinal cord injury, that in a way it opens them up somehow. Not to minimize the suffering, but in a way it opens them up somehow. And Julie, there's even some research out there now demonstrating that when we get what we want, acquisition, that, it could be the new car or the house or the job or whatever it is, it tends to make us happy for somewhere between 90 days and 120 days. After that, we go back to baseline.
So
Trauma,
you're constantly reevaluating yourself then
exactly.
every 120 days.
Exactly. But your body goes back to baseline. But when you're walking down the street and all of a sudden there's no sidewalk under you, that opens everything up. I'm sure all of us have had that experience, and not just people in wheelchairs. Almost every adult I know has had that experience where all of a sudden there's no sidewalk under you. Have you?
When you want to achieve, you have a big, because you were mentioning it's a big goal. It's a big part, looking at the big picture. And I know that when we all have big goals and big dreams, to realize those, we're always taught to think of it as a pie and divide it up into smaller pieces to gain the larger picture. And sometimes it's really difficult to find that first slice to fill in to get to your goal.
Well, see, I don't see it as a goal per se. It's just, okay, who am I now? What am I now? I saw a man, Julie, in consultation years ago. He had severe obsessive-compulsive disorder, so severe he couldn't leave the house, on very rare occasions. So, I first saw his mother, and she was all upset. He was an adult male in his late 30s, could have been early 40s. She was understandably upset and wanted me to see him for a consultation. I said, if he wants to come in, I'll see him for one time, but that's all I have time for. So he came in begrudgingly, and he just went off. You're not going to be able to help me. Nobody's able to help me. I've got this disease. I'm going to have it for the rest of my life. And I said to him, just stop a minute. Stop and listen to yourself. I said, I'm not arguing with you. I agree with you. I'm not able to help you. Let's say nobody's able to help you. Let's assume you're right. You're going to have it for the rest of your life. There's only one question now. Is now what? How shall I live with what I have, with who I am? How shall I live? And when you ask that question, then you're taking back your life from your symptoms. Then your symptoms are no longer in charge of your life. How shall I live?
Dan, John had a question, and he left it in the chat box.
Could you read it for us?
Yes. It says, I have a C4 incomplete spinal cord injury. My wife and I have lived in poverty for 10 years. My state offers no assistance. He doesn't have enough for insurance, neither does his wife. He's talked with the Reeve Center, I believe that means probably the Reeve Foundation Paralysis Information Specialist, and some other groups, and he's asking, how do other pay for caregiving? How has my world changed? Now I'm a cynic. So which he brings up a really good point, because now he's looking at everything negative, so how can he turn that around?
Well, you don't turn anything around unless you want to. My question was an honest one, and it really wasn't goal-directed. Just how has your world changed? And I guess what I'm hearing from John is that he was not always a cynic, and now he is. And you know, if he wants to change it, I mean, this doesn't have to be your worldview. What John is doing, cynicism to me is anger. It's just anger. And anger is about injustice. Anger is almost always about injustice. It's the way we react to injustice. I read, you know, what John's going through, and I hear that story a lot, and I get angry. So underneath it all, underneath the cynicism, is anger. As a result,
I don't hold that anger. I look more forward to getting better. I'm not angry about it. I'm excited about overcoming this, and to show other people that this can be done.
Oh, I thought you said you were a cynic.
No.
Oh no, I got the names wrong. Who were you reading, Julie?
I was reading a comment from John, and who was speaking? Was that Brian?
This is Brian Bomboy speaking, yes.
Right. So the comment left was from John. So, different person.
Yeah, so I was talking to John, Brian.
Okay.
All right.
I'm not on the computer where I can leave you a message on the box. That's why I wanted to talk to you directly.
No, that's fine, Brian.
All right, you get your information from Julie?
Yes, and I filled out applications. 2 years ago, I asked to be enrolled into a clinical trial study, but I never got any response. But I've been trying back and forth to figure out how I can get there and become a part of the program.
Well, I'll do this because we want to get back to the topic on hand here. I'm going to do this. I'm going to volunteer Julie to follow up with you on this. Is that reasonable, Julie?
Absolutely.
All right, and so I hope I didn't make you mad at me here.
No, that's okay. Is this Dr. Dan now?
Yeah. So Julie will follow up with you, and we're going to go back to the topic here. Could you please put your phone back on mute? Which one is that, Julie? 6-3 to mute?
Yes, mute is 6-6. To unmute is 6-3.
So could you press 6-6 and just listen in, okay?
I'm sorry. On the regular telephone, you mean?
Yeah,
yes, on the regular telephone. And then Brian,
6-6.
Yes,
okay.
Brian, you can email information@christopherreeve.org, which I'm looking at right now, and let me know your contact information, and I'll make sure.
Okay, I did email several things to the Christopher Reeves, and there was a call back from a Donna who took all my information.
Okay, great. Then you're in our system, so I will follow up with Donna.
Julie will be able to follow up. Just press 6-6
Thank you,
for
Brian.
us. Okay.
Press 6-6 for me.
All right.
Thank you.
Thank you so much.
Okay, they'll take it off the mute.
Please note it is 6-3 to mute your line and 6-6 to unmute.
I'm sorry, say that again.
It is 6-3.
6-3. Julie and I made a mistake with the numbers. At least we're both on the same page.
6-3?
Yep. 6-3.
Just push 6-3?
Yes.
Yep.
Thank you, Brian.
Okay.
Okay.
Yes. Dan, is it healthy to dwell on the shoulda, woulda, couldas? Does that lead into cynicism?
That's torment. No, it's not healthy. It's torment. And anybody who does it, knows that it's torment. It's I call that the persistence of the impossible. It's like when the brain tries to rewrite history. It's just awful. It's just awful when that happens. And, we feel powerless. I don't know about you, Julie, but when most of us do it, myself included, your brain gets into this endless loop. You feel like you can't get out of it. And it's just torment. What we need to do when that happens, and I'm going to invite you, Julie, to do it right now with me. You're going to do an experiment with me?
Absolutely.
All right. So I want you to look at your mind and notice how it's thinking right now. Not the content. Don't get hung up in the content. But is your mind going fast or slow? Are the thoughts pleasant or unpleasant? Is it focused or all over the place? Just take a look at your mind and see the nature of it right now. Okay? Did you do that?
Yes.
All right. And what did you discover? How is your mind?
Certainly anxious, trying to put things in priority. Even
right.
how I'm going to handle the rest of my day, but breaking that down.
Okay. So you said anxious, and if I can move that anxiety, which is a bodily sensation, yes? Anxiety we feel in our shoulders or our chest or our gut, wherever we feel it. But let's move that up into your mind. And anxiety in the mind is usually a fast-moving mind, darting around. Did you notice any of that?
Absolutely.
Okay, so here's what you just did. What you just did is called metacognition. You took a step back and you observed. You observed your mind. You observed your emotions. Just in that moment of anxiety, you took a step back. And I will guess that in the moment you took a step back, your anxiety went down.
Absolutely, because I took, right when you asked me to do that, I took a deep breath.
Yeah. Right.
And that was the start of my calming down and then being able to refocus and rethink.
Okay, so, but I didn't even ask you to rethink.
No.
Even to refocus. Just take a step back and just observe. I didn't even want you to get less anxious. I mean, because I wouldn't have been able to make my point. I'm very happy you were anxious. I'm sure you weren't thrilled, but I was able to make my point here. So, getting back to your original question, and I'm guessing you wondered if I ever would. So we'll get back to your original question about the woulda, shoulda, coulda stuff. So when that's happening, your mind is in this repetitive loop. So all I'm inviting you to do, or anybody who's stuck in this woulda, shoulda, coulda, or this obsessive thinking about the person who betrayed you, is to take a step back and look at the nature of your mind right now. And don't get lost in the content of it. So when that happens, you can look and see that the mind is racing. I can even notice that my mind hurts when I do that, and I'm not aware of it when I'm lost inside, that my mind actually hurts, that I can drop down below my neck and notice that I'm highly anxious or helpless or sad or feeling impotent or anger, and that all these emotions are driving those thoughts, and I can just observe that whole package of things. And as long as I'm observing it, that endless loop tends to stop. If I focus my attention now on the loop, I'll be right back in it, or the emotion, I'll be right back in it. Or if I focus my attention on the temperature in the room, or my voice, or the way the chair feels underneath your butt, or the way your feet feel on the floor, or the odors, the ambient odors or sounds in the room. So that's what you can do with the woulda, shoulda, coulda. Because nobody wants to live with the persistence of the impossible, So that was a long answer to your question. Was it adequate?
Yes. How do you know when you need to ask for help?
Oh boy, would I love to hear others weigh in on that. Is anybody going to chime in on that? Anybody want to chat? No.
Paralysis yourself?
Pardon?
I was asking Julie, does she suffer with paralysis herself?
No, I am not spinal cord injured.
Okay, that's all I wondered, because the question the doctor's asking is the would've, could've, should've, and I go through that sometimes, and I put that all behind me, and I think of what I can do and what I can show people that's possible to overcome, no matter what your affliction is.
Well, that brings us all the way back, and Julie, I want to follow up with you on that. But I said way back when, all of us, grown-ups, almost all of us, have experienced trauma in our lives where there's no sidewalk underneath us. And you were just asked if you suffered spinal cord injury. I wonder what it was like for you when you were asked that question. Was it uncomfortable? I'm sure you were asked it a lot. Was it uncomfortable for you, Julie?
Yes.
Yeah, it's like, are you in our club? But I'll venture to say, Julie, and to everybody listening, that this is a guess, that I have not experienced anything that you haven't experienced. For example, the underpinnings of this, the experience of this, is to feel alone in the world, to feel helpless and out of control, is to feel shame, to feel unlovable, to feel as though no one will ever understand me again, is to feel helpless and hopeless and overwhelmed with my life. So, I mean, that's a quick and dirty summary, but have you experienced any or all of those emotions in your life? Yeah. So there. So now you're in the club. This. When we tell our story, Julie, I did a radio show Monday, on complaining and the effects of complaining. And, of course, nobody likes a complainer, but what we're really trying to communicate is, not that the boss is a pain in the butt, or not that, my body doesn't do whatever it doesn't do. We're trying to communicate who we are at core, So telling you about my catheter and dysreflexia, or whatever I have, telling you about that, you might be curious for a little while, but if it goes on and on, you're bored, and understandably so, or annoyed. But what I'm really trying to tell you is that it hurts, that it comes up without announcement, and I feel helpless and nervous when it happens. So that's different, That's communication. It's talking from the inside out, not telling you about my outsides, because we're different, But when I tell you about my insides, you get it. Of course, that takes more. That is more difficult to do for most humans. For typical humans. What I like to call normal humans, as opposed to me.
I would love to hear from somebody else on the call, on the webcast.
I
was
would
hoping
too.
that everybody can hear us.
Yeah, I would too, because frankly, I'm starting to get on my...
Say hi.
Hi?
I heard a hi. Yay! Thank you.
Can you hear?
Yes,
Yeah.
I can hear you.
Really, we need somebody to rescue us here.
Yes. I can hear you real good. I've been asking questions and telling you, with my paralysis, I overcame more than I was ever expected to ever happen.
Yeah.
And I'm looking forward to moving forward and taking back the rest of my life so that I can be a part of the work community and things that I enjoy doing on my own again.
Yeah, and we had a whole topic about that, and I'm gonna turn our attention to the woman who wants to join us. But we had a whole discussion, Julie, about hope that helps and hope that hurts, and that's a whole different issue. So looking forward to reclaiming our lives is the kind of hope that helps. I'm going to ask everyone if you're not going to be actively in the conversation, please press *63. Was it
663 to mute? Yes.
Okay, 63 to mute. So John, if you can mute 63.
That was Brian.
Who's going to join?
It was
yes.
Brian was talking, but the other people on the call, maybe not. I love Brian's. He's so outgoing. I would love to hear somebody else. This is your time. If you feel like you're not that outgoing as Brian, you can. I'm opening it up. Because I'm getting rid of my anxiety by being here with you all too. So this is good for me. So I think it's probably pretty healthy for someone else. Let's take a little risk, and a little risk is really just saying hi.
Hello?
And tell us a little about yourself.
Hello?
Yes.
Can you hear me?
Yes.
Yeah, I'll say hi.
Hello.
I'm not at work at the moment, so
Sure. What is your first name?
Trying my best. Oh, my first name is Jason.
Hi, Jason.
I'm in Indiana. And I'm at work at the moment, so I wasn't able to follow as well as I should have. But I truly, I guess, have the same feeling about, when you think, what if, what could have been. I definitely go through all those same, I guess, emotions. So just chiming in, really.
Jason, were you able to hear my conversation with Julie?
Yes.
And are you comfortable talking now at work?
Yeah, sure.
Okay. Are you going through that now? At the moment?
I want to say no.
Okay. Can you give us an example?
Well, honestly, I really just don't think about it. Because whenever I want to think about it, I just kind of, do something that takes me away from thinking about things like that. So.
Jason, can I ask you, what kind of work do you do?
Oh, I'm an engineer.
An engineer, but you're able to work. Do you have a spinal cord injury?
I do.
You do, but you're still able to do that, huh?
Yes.
That's great. That's really great to know.
Jason, you say you don't think about it. So I hear that you say you just distract yourself.
Right. That's kind of what I do to cope, I guess.
Right.
So you're successful at that.
Well, I guess
sometimes.
so far. I want to say,
Jason, can I ask you, Jason, do you have use of your hands?
Let me take charge of talking with Jason, okay?
All right.
I want to get to know him just a little bit more. All right?
Yeah.
Jason, could you come back to the original question about how has your life changed since you've been injured? The good news and the bad.
Yeah. Yeah. So okay. Let's go with the bad news. Everything has changed, right? Everything has changed. Pretty much a new life. You gotta pretty much kind of start over on how you look at things, how you approach things, how you solve problems, how you basically everything, right? That's the bad thing.
Mm-hmm.
Your whole life changes, right? Upside down. The good thing, you see life
going nowhere.
from different perspectives. You really appreciate, of course, so simple, stupid things, right?
Like what?
The things that you don't think about. Just taking care of yourself. I don't know, getting stuff done. Things that people take for granted, right?
What about relationships, gratitude? Do you feel more or less gratitude, more or less love?
Well, I would say for sure I am more appreciative, more gratitude. Yeah, I have more gratitude for what people do for me. Mm-hmm. I find me personally, I love more. So, or at least people tell me that I've turned into more of a loving person, right? So, but I'd say that's a good thing, right? That came out of all of this.
Well, I don't know. It makes me happy. I don't. How old are you?
Oh, 27. 27.
My goodness. Yeah, that's a whole lot of wisdom in a young life.
Oh.
To be more grateful.
Oh yeah.
To be more loving, especially for man. Men usually don't get that for many decades after. So, that's the deal here, Jason. It's a funny thing, these great tragedies happen to us. And so many of us wind up feeling more grateful than we were before. Even after all the loss and because of all the loss.
Yeah, this kind of doesn't make sense, right?
It doesn't make sense, and it doesn't get talked about. But what you're experiencing is more universal than not. Universal is too big a word, but common. It's very common.
Right. It's almost to say like being injured or having something traumatic happen to you kind of shapes you into a better person,
Yeah.
Almost like I got injured and then went back to school and back to college, right? And I was a lot more focused and kind of really had a clear goal. So I don't know. And before the injury, I kind of didn't know what I was doing. Just kind of just lived life like for whatever it was, right? So
yeah, it sounds like you were able to ask the big questions. What now? Right. What am I going to? It just takes you off.
Yes. It
takes you off automatic pilot. And so many people live on automatic pilot their whole lives, and they're not happy. They don't know why. Right. And Julie knows, all of us know that when the sidewalk falls away, then we're off automatic pilot. There is no more.
Right.
Gives us that opportunity. Well, Jason, you made me happy today. I'm so glad you called and
no problem.
Yeah, it's nice to meet you.
Yeah, nice to meet you too. I've been a long listener, pretty much from the beginning of these. Never called in, because most of the time I'm at work. So when I'm listening, I'm trying to still trying to get work done. But I try to listen in every time anyway. So
yeah. Well, thanks so much. I appreciate it.
Yeah.
And I'm going to recommend, because this book I wrote is I wrote a new book, and it's right on this topic. It's called The Wisdom We're Born With: Reawakening Faith in Ourselves. And it's just this issue. There's this quality inside of an ability to love freely and generously. I mean, that's what all babies and toddlers have, and then it goes underground. But every time we're knocked on our butts, every time I keep using the sidewalk metaphor. Every time we're knocked down, it opens us up. It has the potential to open us up, knock us off autopilot, and open us up to that loving heart that we were born with, and that's what happened with you. Jason, thanks so much for calling in.
Thanks, guys. Bye.
Take care.
Thank you, Jason.
So, Julie.
Right.
Julie?
Yes, Dan, I am here.
Yeah. That was a sweet phone call.
That was wonderful. He had mentioned he's been a long-time listener and I guess first-time caller type of thing. But I was I hope that he definitely will call in again, because his voice was so cheerful and so positive sounding.
Yeah. Oh, I forgot to ask him where his accent was from. Damn.
Well, hopefully he'll join us again.
Yeah.
I can answer that.
Jason, you're still there. Great.
Oh, yeah, please.
Yeah, I just muted it, but also I grew up in Barbados. That's in the Caribbean. And then I moved to Florida for college, where I got hurt on a motorcycle, and then I moved to Indiana, where I work and live now. So
yeah, that's way different from Barbados.
Oh yeah.
Wow.
That's why I couldn't place the accent, because it's not a familiar one.
Right. Yeah.
Barbados. It's a lovely accent.
Okay.
Lovely.
All right, guys.
All right. Well,
thanks again.
Okay. Bye.
Thanks for taking care of all my confusion here. So, Julie, here we are. Here we are. We've kind of covered, and with Jason's help, we've kind of brought it from beginning to end about what things like this do to us, the good news and the bad news. I hope it was of value to you. I certainly, and my God, to those who who joined us and listened in. I hope it was of value to you. I see my dear friend Dina is there. Julie. She is the dear friend I referred to who asked me about my current relationship and would I have been able to be in it, before the accident.
Well, thank you, Dina.
Yes,
Hi. It's great to be here.
So I really do want to thank everybody who joined us today. I hope you join us next month. It'll be the first Monday in June. And the first Wednesday in June at 3 o'clock. And we'll all decide together what we're going to talk about. I'm usually comfortable talking about whatever you like to talk about. Julie?
Yes, I am here.
How was our first dance together?
Well, I apologize for the late beginning, but besides for that, Dan, you are wonderful as always. I love listening to your radio show, and I've been listening to that for years before I even met you. So you just have that comfort quality in your voice that
Thank you.
Makes it really easy for, I think, even people like Jason, finally to call in and talk, and it's great. And
well, Julie, I really look forward to working with you in the future. We'll get to know each other a little better. That's always fun.
Oh, yes. Yes, and if you all join, I will open up more and let you know the other clubs I'm in.
All right. Well, I want to thank you all. I have to scamper because I've got an appointment right at 4 o'clock.
Okay. Well, thank you, Dan. I want to thank everybody for joining us. Dina, I see Dina, Joan, John, Mary, Michelle, and Timothy, and Brian. And please watch our website at ChristopherReeve.org. And also our Facebook, and we will be promoting other Dr. Dan webcasts, and hopefully we'll talk to you next month. And thank you, and that will be ending our webcast event for today. Thank you.